Hi guys, welcome to Medical Coder Life, the day in the life of a medical coder. Today I want to start a series on physician documentation, the forms that physicians use in the medical record. Remember, as a medical coder, we code physician documentation. That's not to say that we don't review other documentation, such as nurses' notes, respiratory therapy, lab work, x-rays, etc. But we as coders do not code from these documents. However, I found these other forms of documentation to be very supportive in my understanding of exactly what is going on with my patient. Guys, when I read a medical record, I look at each encounter as a story. I love to put myself in my patient's place and try to understand exactly what is going on with my patient. I imagine myself going to the physician's office and explaining to him or her my chief complaint. And remember, we said a chief complaint is the patient telling the physician their symptoms that he or she is experiencing. And then based on these symptoms, the physician looks for signs of a disease process, right? So should this patient require inpatient care, which is care in the hospital setting, the physician then completes the admission order along with a history and physical. Okay? Based on the admission order, the hospital then proceeds to admit the patient to the hospital and assign the patient a bed. Please note that in order for a patient to be admitted to the hospital, they must meet admission criteria. For a long time, I thought if you wanted to be admitted to a hospital, all you had to do was ask. Might want to rest a little while, get away from home, get away from kids, get away from husband, just relax, right? Well, if you're expecting your insurance company to pay for that stay, it's not going to happen just because you want it. You have to meet admission criteria. Ultimately, you must meet what's called intensity of service and severity of illness. This just means that whatever disease process the patient is experiencing, it must meet services that can only be rendered in an inpatient setting. That's where your intensity of service comes in, and be severe enough that it cannot be handled on an outpatient basis. Severity of illness. So those are two criteria: severity of illness and intensity of service. It must meet inpatient criteria, and it must be severe enough that it can only be treated on an inpatient basis. Now, once the patient is admitted to the hospital, the physician is required to complete, in addition, he's already done his history and physical and his admission order, then he has to do daily progress notes. These notes can be short, but prove that the physician saw the patient each day that they were in the hospital. This is documentation. This is proof that your physician came to see you every single day while you were in the hospital. Now, in a subacute care hospital or setting, physicians are only required to document once every 3 days, and in a long-term care, they're required to write progress notes once every 30 days. So again, in the acute care setting, daily progress notes are required. The physician will also document physician orders. These orders document the care that the physician wants rendered to the patient. They can consist of requiring respiratory therapy to come in and administer oxygen, x-ray to transport the patient to the radiology department for x-rays, for lab services to come in and draw blood. Okay? These physician orders are expected to be completed within 24 hours so that by the next day when the physician comes back to visit the patient, the physician can review the results of these tests. Okay? Those are your physician orders. Now, should the patient require surgery, an op report is to be completed within 24 hours of surgery. Immediately following the surgery, if the op report is not complete, then a progress note that's a summation of the surgery is required until the actual op report is completed. Now for the ancillary services, which are the x-rays and the lab, etc., look to make sure that your physician has signed off on these. This is your proof that he or she, your physician, viewed the results of these services. And in looking to see if your physician viewed them, signed off on them, a lot of times they just put their initials on it and the date that they saw these lab reports. View the results as a coder. And because as a coder, this will aid you in your confirmation of the final diagnosis of the patient. Because a lot of times they'll tell you a fracture of the femur, but it doesn't exactly explain where, and you can view that x-ray report and see whether it was on the dorsal side or exactly where on the femur it was, because you know with ICD-10 we've gotten more specific with our coding. So these lab or x-rays, etc., these ancillary reports come in handy to view, but again our final diagnosis comes from the physician. And finally, the discharge summary is required on any stay that is greater than 48 hours. For a stay less than 48 hours that's uncomplicated, it only requires a final physician progress note. The discharge summary is a summation that the patient stay in the hospital. It summarizes from beginning to end that stay. It should be completed immediately upon discharge from the hospital. Both DHEC and the Joint Commission, which are licensure and accreditation bodies that oversee facilities, hospitals, require that the discharge summary be complete within 30 days of discharge. So, take this journey with me as I describe each of these physician documentation forms in detail. I'll be talking about time requirements of each, what's required in each form, an idea of what it should look like. I'll be covering the discharge summary, history and physical, progress notes, op report, physician orders, and any other type of form that, like that physician order that I talked about earlier in order to admit the patient to the hospital. I'll also discuss bylaws, rules, and regulations when it comes to timely completion of each of these, and how I use this information to complete my coding of my charts. So stay tuned with me, and your first video will be coming up on the discharge summary. All right, thanks guys. I'll see you in the next video.